Public health is built on one foundation, trust, and trust, like any biological system, is shaped by consistent signals, clear communication, and repeated reinforcement over time. When science becomes fragmented, when messages shift without context, or when data is delivered without transparency, the nervous system of society responds much like the individual brain does in uncertainty, with confusion, withdrawal, and ultimately disengagement. To improve science and restore trust in public health, we must treat communication as a biological process, not just informational, but neurobiological. People don't respond to data alone. They respond to how that data is framed, whether it feels predictable, whether it reflects honesty, and whether it connects to something they value. When there's a mismatch between messaging and action, the brain detects incoherence and flags it as a threat. That's not a failure of logic, it's a built-in protective mechanism. Science at its core is iterative. It evolves, self-corrects, and improves with new evidence. That's a strength, not a weakness, but it must be communicated as such. Transparency about what we know, what we don't know, and how conclusions are reached actually calms uncertainty, because it mirrors how the brain itself navigates change, with measured updates and an internal system of trust built on pattern recognition. Rebuilding trust in public health means returning to that biological truth. It means elevating communication that respects intelligence rather than oversimplifying, being honest about uncertainty rather than pretending to have all the answers, and creating feedback systems where the public feels seen and heard, not managed. Like any healthy nervous system, a society thrives when its signals are clear, consistent, and rooted in integrity. When we align the science of communication with the science of biology, we don't just restore trust. We strengthen the entire system it's meant to protect. Trust in public health functions like a biological system. It responds to consistency, clarity, and repeated reinforcement, just like the human brain does under uncertainty. People respond to how information feels, not just what it says. Emotional safety, honesty, and alignment with personal values determine how data is received and acted upon. Incoherent or shifting public health messages trigger a threat response in the brain, leading to confusion, skepticism, and disengagement rather than compliance or trust. Science is iterative by nature, and public understanding improves when we communicate that uncertainty and updates are signs of strength, not failure, in the scientific process. Effective communication mirrors how the brain builds trust through patterns, transparency, and openness about what is known and unknown. Restoring public trust requires respect, honesty, and engagement, not oversimplification or control, but biologically grounded feedback, informed communication that treats the public like intelligent participants. Would you like me to expand one of these points into a 300-word section? Trust in public health operates much like a neural circuit. It requires consistent signaling, reinforcement, and integration over time. Just as the brain learns to trust its environment through predictable feedback loops and coherent input, the public learns to trust health authorities through repeated, reliable communication. When those signals are clear and consistent, the brain, and by extension, the public, can anticipate what comes next and respond with stability. But when those signals become erratic, contradictory, or missing context, the nervous system detects a threat. This isn't a failure of logic, it's a survival response. In the brain, incoherence between expected and actual input leads to uncertainty, anxiety, and withdrawal. The same is true for communities trying to make sense of complex, evolving health information. Public health is not just about issuing guidance or presenting statistics. It's about communicating in a way that the brain can process, internalize, and trust. If a recommendation changes, that change needs to be explained within a coherent narrative, just as the brain requires context to update its internal models. When public messages shift without explanation, it mirrors what neuroscientists call a prediction error. Where the brain loses confidence in its model of the world, repeated errors without clear correction reduce engagement and increase distrust. To rebuild that trust, Health communication must operate like healthy neural communication: timely, precise, and framed in context. Just as a neuron signals only when necessary and builds stronger connections through consistency, public health must prioritize clarity over volume, coherence over control. It's not just about information delivery. It's about the way signals are structured and perceived. Trust is not an abstract concept. It's a biological, behavior-driven state that can be built or lost based on how consistently and transparently we communicate over time. Humans are not just logical processors of information. They are biologically wired to respond to the tone, emotional resonance, and perceived safety of communication. This is especially true in the realm of public health, where the stakes are high and uncertainty is common. People don't simply absorb facts. They evaluate them through a filter shaped by emotion, personal experience, and social context. The brain's limbic system, which processes emotion, plays a major role in determining whether a message feels trustworthy. When information is presented with clarity, honesty, and respect, the nervous system interprets it as safe and approachable. But when messaging is cold, condescending, or inconsistent, it triggers a defensive response even if the content itself is scientifically valid. In other words, how something is said can be as important as what is said. Trustworthy communication engages both the rational and emotional brain. When public health guidance aligns with a person's lived reality and acknowledges uncertainty without fear or avoidance, it reinforces a sense of autonomy and understanding. The brain interprets that coherence as a sign of reliability, which increases openness to future messages. This is why public health efforts that rely solely on statistics, mandates, or fear-based appeals often fall flat. They fail to activate the neural circuits involved in trust and connection. Instead, they may trigger stress responses, cortisol spikes, attentional narrowing, or even distrustful behaviors, especially when people feel unheard or judged. If the emotional tone of communication clashes with the lived experience of the audience, the message will be rejected, regardless of its accuracy. Effective public health, then, must be grounded not only in data, but in the biology of trust. When we speak to both the thinking brain and the feeling brain, we create conditions for long-term understanding, alignment, and behavioral change. When public health messages shift without explanation or feel inconsistent, they trigger a biological response in the human brain, similar to what happens when expectations are violated. The brain is wired to predict patterns. It uses past experiences and environmental signals to build internal models of how the world works. When those models are disrupted unexpectedly, a neural event called a prediction error occurs. This process activates the limbic system, particularly the amygdala, which detects uncertainty and possible threat. In day-to-day life, this might be helpful for noticing danger, but in public health communication, it can lead to confusion, anxiety, and ultimately distrust. When people hear conflicting health advice, such as changes in mask guidance, vaccine recommendations, or shifting definitions of risk, they often don't have the scientific framework to understand why those changes occurred. Instead, they perceive the inconsistency as instability or incompetence. The nervous system, especially under chronic stress, doesn't distinguish between a change based on new evidence and a change born of uncertainty. Without clear framing, the change itself feels unsafe. This is not a failure of intelligence. It's a neurobiological response to broken pattern recognition. What's needed in these moments is not silence or spin, but a deliberate effort to explain why the guidance changed and how the new information fits into the larger picture. That process mirrors how the brain recalibrates when its expectations are violated. It looks for a new, more reliable pattern. Just as neurons build stronger synaptic connections through repeated and coherent firing, trust in public health is rebuilt when messages are not only accurate, but also predictable, contextual, and responsive to evolving understanding. When people feel the system is willing to explain, not just instruct, the brain shifts from a defensive mode into an adaptive one, ready to listen, engage, and act. Science, by its very nature, is a self-correcting and iterative process. It evolves over time as new data emerges, technologies improve, and understanding deepens. In the context of public health, this evolution is not a sign of instability or failure. It's a core strength of the scientific method. However, if this process isn't communicated effectively, it can be misinterpreted by the public as contradiction, confusion, or unreliability. The brain naturally craves stability and predictability, especially in times of stress. When recommendations change, such as shifting guidelines on nutrition, disease transmission, or treatment protocols, it can feel to many people like the ground is moving beneath their feet. Without a clear narrative around why those changes occurred, the brain interprets the uncertainty as a threat. What's required is transparency, not just in the data itself, but in how and why that data leads to revised conclusions. When people understand that updates are a reflection of new learning rather than past mistakes, it activates a very different neural pathway. Instead of triggering fear and skepticism, it activates curiosity and adaptive reasoning. Just as the brain rewards learning through dopamine release when progress is recognized, society becomes more open to scientific updates when the process of discovery is made visible and relatable. When public health leaders say, "Here's what we believed based on the data we had, and here's how we updated our understanding based on new evidence," they align their communication with the way the brain updates its internal models. This fosters psychological safety, a state where people feel they can trust changing information without feeling destabilized. Communicating science as an evolving journey rather than a fixed doctrine helps build resilience not just in the system, but in the individuals it serves. It respects both the intellect and biology of the people it aims to protect. Trust is not built through information alone, it's built through patterns. The human brain thrives on predictability and coherence. When it receives signals that are repeated, well-timed, and logically structured, it begins to trust those inputs, whether they come from a person, an environment, or an institution. This is the basis of secure attachment in human relationships, and it also applies to how people relate to systems like public health. If communication is clear, regular, and transparent, even in moments of uncertainty, the brain recognizes it as stable and trustworthy. But when communication is erratic, overly technical, or absent during key moments, it creates what neuroscientists call signal noise. In those moments, the brain becomes hypervigilant, scanning for danger, often filling in the blanks with fear or misinformation. Public health communication must be modeled after the way the brain naturally builds trust, through regular, context-driven feedback loops. When we repeatedly hear accurate, understandable, and open-ended messages from a source, we begin to associate that source with credibility, even if we don't agree with every detail. This doesn't mean oversimplifying science or pretending to have all the answers. It means being honest about what's known, open about what's evolving, and direct about how decisions are made. The brain's prefrontal cortex, responsible for decision making, logic, and planning, relies on consistent inputs to guide future actions. If those inputs vary wildly or lack coherence, the prefrontal cortex is overridden by emotional centers like the amygdala. That's when people stop listening to evidence and start responding from fear or frustration. Effective public health must avoid triggering this threat circuitry by creating communication patterns that feel stable and earned. In doing so, it doesn't just transfer information, it cultivates the neural conditions for trust, long-term cooperation, and collective well-being. Restoring trust in public health requires more than accurate facts. It demands a fundamental shift in how communication is approached. At its core, this means treating the public not as passive recipients of information, but as intelligent, emotionally attuned participants in a shared system. When health messages are delivered in a top-down, impersonal manner, people often feel dismissed or controlled, triggering resistance, skepticism, or withdrawal. The human brain is wired for autonomy and relational connection. When it perceives respect, transparency, and genuine engagement, it opens up to new information. When it senses coercion, judgment, or disconnection, it shuts down. even if the message is scientifically correct. The biology of trust involves more than data. It involves how that data is framed, who delivers it, and whether the receiver feels included in the process. Engaging the public in a two-way communication loop, through listening sessions, community input, and culturally aware messaging, mirrors the brain's own feedback systems. It says, you matter, your perception matters, and your role in this is vital. This not only increases trust, but also improves outcomes, as people are more likely to follow guidance they feel connected to. Oversimplifying complex information can also backfire. It may temporarily reduce confusion, but it can erode trust when people sense they're not being given the full picture. Instead, complexity should be acknowledged and made accessible. The prefrontal cortex, responsible for rational thought and long-term planning, responds well to nuanced, well-explained guidance, especially when paired with empathy and humility. Rebuilding trust in public health is not about convincing everyone to agree. It's about creating a relational system that mirrors the brain's own need for clarity, consistency, and emotional safety. When communication is rooted in both neuroscience and respect, it doesn't just inform, it invites people into a healthier, more collaborative future. Improving science and restoring trust in public health is not a matter of louder messaging or more data. It's about aligning communication with how the human brain actually works. Trust is a biologically grounded process, built through consistent signals, emotional safety, and clear explanations over time. When people feel respected, informed, and engaged, not managed, they become open to change, resilient in uncertainty, and capable of making decisions that benefit both themselves and their communities. Public health must move beyond delivering information and toward building relationships. That requires honesty about what's known, transparency about what's evolving, and humility in how guidance is offered. When communication reflects the same principles that govern trust in the nervous system, predictability, clarity, feedback, and coherence, it creates a system people can believe in, even as the science continues to grow. Rebuilding that trust isn't just possible, it's a biological imperative for a healthier future.